What many people don't know is that infertility is considered a disease by the World Health Organization. They recently released a study that says that it affects 1 in 6, where previously it was 1 in 8. And so that means that we're not trending in the right direction. And so it's very important that we have these conversations. And one of the things that I do like to emphasize, even though I try to explain things from the Black experience of it, infertility affects everyone. It is something that affects people worldwide, and it goes beyond simply the inability to get pregnant. It also includes the inability to maintain a pregnancy. So it includes miscarriage. It also is a larger reproductive health issues, including endometriosis, fibroids, all of that. And so it is a very important and relevant topic to women's health overall. And so I have found so much joy in spreading the information about this topic. So as mentioned, I am a librarian. I'm actually the head of youth services at a suburban library near Chicago. I've been a librarian for over 15 years. And how these two things overlap is because as a librarian, I thought I'd be able to find information when I wasn't able to get pregnant and I wasn't seeing anything happen. I just was like, well, how do I get information if I, as a librarian, can't find any? That means that the people who don't have these research skills are probably really having a hard time getting information. So I got married relatively young. I was a part of an online community called Chocolate Brides, which is where I met Dia. And I didn't know that this affected so many people. And I especially didn't know that it affected Black women at all, because the narrative that I saw in regards to in vitro fertilization and all of these other treatment options, all of the marketing showed either people who were very, very rich or white. And I didn't think that it affected Black people at all until I saw some of those women talk about the experiences that they were having. And then it clicked to me, here's something that's going on with me as well. I suffered from extremely long periods, sometimes lasting upwards of 30 days. And I could not get any information when I was going to the doctor. I felt like I wasn't being heard and I wasn't getting much feedback at all. From that and researching as a librarian, I started to learn about polycystic ovary syndrome, hypothyroidism, fibroids, and uterine polyps. And learning all of that, plus blogging about my own experience, led to the creation of the Broken Brown Egg, which is a 501c3 nonprofit that exists to empower, inform, and advocate for those experiencing infertility. So that's a little bit about me. I've been a foster parent. I do have a son that we had as a result of IVF, but I try not to call him my happy ending because everybody's journey with infertility and reproductive health does not end in a baby. And I feel that sometimes that gets left out of the conversation as well. So what is reproductive health? You can take a minute and think about it. You can drop them in the chat. You can also unmute and say if you think you know. Many times what we think is reproductive health is actually sexual health and sexual information, and doesn't include the reproductive part of it. So many of us got information in sexual education classes, or in college, we may have had a course that explained it, but we didn't get full reproductive health information. We got mostly sexual health information and preventative information. So according to the World Health Organization, reproductive health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity in all matters relating to the reproductive system and to its function and processes. And I love that they defined it this way, because what I find in working with so many people who are experiencing reproductive health issues is that their mental health is often challenged as well. So if someone is experiencing extremely long menstrual cycles that they think are normal, because very often people don't talk about it with amongst one another, then they're experiencing higher levels of anxiety, higher levels of depression, and in many cases, similar reactions on an emotional level to those who are experiencing post-traumatic stress disorder. So I appreciate that they include that it is your mental. And then in terms of social well-being, so often we don't realize that there are times where just general conversation goes right into conversations about what the norm or what is expected to be the norm is childbearing and family building. And we don't think about the fact that for many people, that is not the norm and that they may be struggling. And so that leads to a decline in social activities, social interaction. You may notice that people may not come around. There may be baby showers they don't come to. There may be family events that they can't attend. And that's beyond just the social stigma of it. In many cases, if they're dealing with serious reproductive health issues, they are dealing with irregular bleeding that makes it uncomfortable or even unsafe or unhygienic for them to be out and about. It also could be that they're experiencing extreme bouts of pain. And so it is important that we remember that it is physical, mental, and social, and not just sexual health. Reproductive health is health. These things affect more than just our ability, even though it's reproductive, these things affect more than just our ability to have or maintain children. Many cases, a lot of the issues that affect our reproductive health can also be precursors to issues such as heart disease, um, breast cancer, cervical cancers, endometrial cancers, things like that as well. So here are some of the topics of reproductive health that many people don't think about: adoption and foster care, infertility and miscarriage, cervical and ovarian cancers, menstrual disorders, period poverty, which many times we don't think about. And as a librarian, this is one that is very dear to me as a former teen librarian. I made it my point to have in our teen space in my library free pads and tampons for those who needed it, because we don't often think about the fact that some people can't afford to have safe and hygienic products for their menstrual hygiene. Perimenopause. There are a lot of people who are experiencing menopause symptoms at a much earlier rate than previously, some even in their late 20s and early 30s. And this is something that doesn't get much attention or conversation. And also, I found that from talking to other women who are at the age where they're expecting to experience menopause anyway, they're finding that they haven't been taught a lot about what menopause actually is or what to expect when they're experiencing it. And so this is another area of reproductive health that deserves a lot more attention. Sexually transmitted infections and diseases, but also sexual disorders. There are many cases of pelvic floor disorders, pain during intercourse, a lot of these things that are actually biological that many people don't know that they can go and see a specialist about. Because these topics are so taboo, we find that people are suffering through these issues and not realizing that this is a medical issue that deserves care and respect as well. Abortion, contraception, fertility preservation, such as egg freezing, egg donation, sperm donation, all of those things are included in reproductive health. And then some more of the reproductive disorders. So endometriosis, which is where the lining of the uterus, that is usually what a period is, that lining that is shed during a menstrual cycle, it grows in places outside of the uterus. And that causes extreme pain for people who have that condition. Fibroids, which are small benign tumors that occur in the uterus, that in many cases can grow as large as grapefruit or bigger. And in many cases, some people that I've spoken to, the social and mental stigma of feeling like people are asking them all the time, when are you due? are you pregnant? And it's not a pregnancy, it's these tumors that have been growing. And then polycystic ovary syndrome, which is a metabolic hormonal condition, which I have as well, that can be classified through having multiple benign cysts in the uterus, but it also manifests as irregular facial hair, male pattern baldness, anemia, irregular periods, all of those things encompass it. And so for me, it took quite a few doctors and a few years before someone was able to actually diagnose it. Because it's a syndrome, it manifests in so many different ways that when one doctor didn't see one thing, they assumed it was something else. And when another doctor didn't see the other thing, they assumed it was something else. And so studies have shown that it actually takes women up to 3 different doctors before they get an accurate diagnosis of PCOS, which is ridiculous. And then the maternal mortality rate, preeclampsia, which is high blood pressure during pregnancy, and premature birth. All of these things encompass reproductive health. So there may be a lot more than we thought. So here's some quick definitions of some other issues. Adenomyosis, endometriosis, which I just talked about, fibroids, which I just talked about, PCOS. And then I have some celebrities here because sometimes we think we don't know anybody who's experienced that. And there are many people who in the public eye look like they're totally fine. And then once they're experiencing either a fertility issue or a reproductive health issue that they decide to speak out about, we realize, oh my gosh, they're just like us. And there's a name for this thing that I'm experiencing. Infertility, IVF, which is in vitro fertilization, that got a lot more conversation in the past few years because First Lady Michelle Obama discussed the fact that she also did IVF, and many people were like, oh, I didn't think that, once again, that Black women experienced it, but also someone of her stature, I don't know why, but people felt a disconnect. And so it opened this huge conversation. Preeclampsia, Beyonce spoke about having preeclampsia, and also Serena Williams. There's a few other celebrities who've talked about it. And then postpartum hemorrhage, which is the leading cause of maternal death worldwide, which is exactly what it sounds like, which is irregular, extensive bleeding postpartum. And that one of the myths of it is that it happens immediately, when in fact it can be a few days after delivery, where this bleeding doesn't taper off the way that it should. And so in countries that don't have the healthcare system that we are blessed to have, just think about how many are affected by this, which is also what makes it so disheartening that the United States has such a large maternal mortality rate, because we do have this healthcare system. And so it's frustrating to think that so many have died unnecessarily. So when it comes to Black reproductive health, the way that I tend to phrase it is that it is a reproductive health issue, but it is also reproductive and social justice. And so I'll explain a little bit about that now. So here are a couple of quick facts. So the number of deaths among Black women per 100,000 live births, 42.4. Black women are twice as likely to experience infertility. We are 3 times as likely to experience fibroids. We are more likely to be uninsured, face greater financial barriers to care, lack access to prenatal care, and we experience higher rates of many preventable diseases and chronic health conditions. And that's from the CDC. So here are some additional factors that I like to include when we step away from the studies and the science. the African American community has a history of valid mistrust of the medical industry. There's also topics such as institutionalized racism, a lack of health equity, and a lack of medical literacy. In many cases, people of color and immigrants don't have the ability to have conversations with medical professionals where they feel fully heard or where they fully understand what's being told to them. There are also environmental factors, such as where we're located in our communities and whether or not we have access to care from a practical standpoint. So in that first picture was Betsy, Lucy, and Anarcha. These are three enslaved women who I consider the godmothers of gynecological medicine, because J. Marion Sims, who was the inventor of the vaginal speculum, performed the first successful surgery for vesicovaginal fistula. So this was a hemorrhage, a tear that would happen after childbirth that led to painful urination, incontinence for women who had basically had tears during the childbirth. And J. Marion Sims was able to research and discover how to cure this, but he did that through operating on these enslaved Black women without anesthesia. And so we consider them the godmothers of gynecology because without their sacrifice, which included, their dignity, their consent, which they were enslaved women, so there was no way for them to give actual consent. These are things that we don't talk about often. And J. Marion Sims went on to become the president of the American Medical Association, whereas these women were lost to history. And without their physical sacrifice, we would not have the advances in gynecology that we have today. Henrietta Lacks, there's an amazing book about her. Henrietta Lacks was a 31-year-old Black woman from the Baltimore area. She discovered that she had cancer, and when her treatments began, the physicians that took samples of her cells discovered that her cells were what they call immortal. They continued to grow and develop. And from that, they've used those cells to this day to study countless medical issues. And her cells were used without her permission, without her family's knowledge. And without HeLa cells, we wouldn't even have many of the reproductive health and fertility treatments, including the HPV vaccine, cervical cancer treatments, in vitro fertilization, and also the polio vaccine. Her cells have been flown into space with NASA. Ophelia Settle Egypt, who was a sociologist, a social worker, and reproductive health advocate. She was one who collected slave narratives. And from working with those slave narratives, she was able to assess the impact that that experience had on many of the women who had been enslaved, as they talked about how they were basically bred to be the lifeblood of an economy, and how they would be talked about as, well, this person is going to be a great breeder, and so we'll place them with this person without any care or concern for any, because they weren't considered people. Also, being infertile and an enslaved person puts you in danger, puts you at risk of being given harder labor or being sold away from your family. So there were a lot of things that were coming up from these slave narratives, because the assumption and what the South had been presenting to try to calm concerns about slavery was to say that slaves were content, they were happy, they were taken care of, and what's the problem? They had a place to live and they were doing something meaningful with their lives. Ophelia doing these slave narratives allowed for those people to have voice and explain that, no, that's not the case. And actually, here are some of the other things that were happening. But the reason I also include her is that she was doing studies as a social worker in the Washington, D.C. area and she was studying Black families, and she was trying to understand why there were so many single mothers with hordes of children. And what she found was that those women had not had access to preventative care or contraceptive care. And that then, when they couldn't not get pregnant and they were having more children than they could economically handle, to be able to access the financial supports, in many cases, their partners chose to leave the home so that they could at least apply for the financial support to take care of the family. So her speaking to that and bringing light to that helps to flip the stereotype that Black women were just breeders who just wanted to have all of these children and not take care of them, and actually explained that it was important for them to have access to contraceptive care. She was eventually the director of a Planned Parenthood clinic in Washington, D.C. And then this one is one that is the most known, I would say, and that is the Tuskegee syphilis experiment. So the Tuskegee study was supposed to be an observation of the treatment of, or the effects of syphilis. It took place in Macon County, Alabama, between 1932 and 1972. It was intended to last 6 months. However, it lasted 40 years. The reason why this was such a horrendous thing is that during this study, the cure for syphilis was discovered, and yet they continued to not treat these men. The men were told that they would get life insurance and get taken care of in terms of burial. What they weren't told is that, hey, there's a cure for this. It wasn't until one of the participants went into the military and was given the penicillin shot and was like, oh, so penicillin could have cured this? That's when it came to light that all of these people had been affected. The study involved 600 participants, lasted 40 years. Many of the participants passed away due to the effects of this illness. And it wasn't until very recently, like in the last 10 or 15 years or so, that their families were given any kind of compensation or recognition for this loss and this horrendous attack on consent. This also doesn't include the fact that syphilis was passed to their partners. In many cases, it was passed on to children. So all of these things connected have led to many people of color having a very valid mistrust of the medical system. And so it's easy to say, well, just go to the doctor. If there's a problem, we'll just go to the doctor. We'll just go get tested. We'll just take the vaccine. Whereas in many of our communities, we have developed this fear, very valid fear, that my biology will be used without my consent, that I could be harmed. There are also historical studies that explain how, in many cases, predominantly Black communities and immigrant communities were used as feeding grounds for those who were training to become medical professionals, because it was a lucrative career for grave robbers to take the bodies of Black, Indigenous, and immigrant peoples to be used to study surgery techniques, all of those things. So there's a very valid reason why we have the medical disparity and the lack of health literacy that other cultures and communities have. So I often use this as a visual to bring it home. Geographic redlining is something that is done or was done in major metropolitan areas to basically determine who got to live where and help to unofficially continue segregation. So this is Chicago. Chicago is where I'm from. I've lived here my whole life. I'm a South Sider through and through. And it wasn't until I was an adult that I learned about how me being a South Sider is by design. It was in Chicago that many communities were redlined for people of color. And so now Chicago remains one of the most highly segregated cities in the country. So this is Chicago by race. Everywhere you see a pink dot is predominantly Caucasian. Everywhere you see blue is Black, green is Asian, orange is Hispanic. Now that you've seen the city and the racial identifiers of the city, this is where all the fertility centers are in Chicago. And it highly illustrates how, if I've never seen these places, I don't know they exist. I also don't think that I need them. I think, well, only rich people need that, or only white people need that. Whereas in my community, I see more dialysis centers and just things that don't say quality of life. Things that say, we need to police your body. We need to make sure that you're not out here just having all those babies and running up the taxpayers' money and all of those things. And so the idea that I would ever need fertility treatment at all was completely foreign to me. But aside from the fertility treatment, I had so many friends who in high school had menstrual cycles that were so painful they couldn't come to school. And no one talked to them about the fact that that's not normal or safe, and that there were things that could be done even then. So many of them just resigned to the belief that they just would never have kids, or were even told, well, having kids is probably going to be hard for you, but here's these birth control pills anyway. And in many cases, they grew up to discover that they were dealing with endometriosis, fibroids, so many other things. Also in my area is a food, pharmacy, and postal desert. So these are three very real pictures from my community. On the left was a CVS pharmacy that was down the street. In the middle was a Jewel Osco grocery store and pharmacy that was a few blocks away. And then there was a Target that was about 15 minutes down the way. All three are closed. All three, with the exception of the Target, remain vacant. So when you think about having access to the preventative care, access to the medications, if you're not a person who drives, how do you access those things now? There was also a Walgreens at one point that is also gone. It is now a dialysis center. And then you could say, well, CVS, you can get your prescriptions mailed to you. Well, the 4 worst performing mail locations in Chicago are all in Black neighborhoods. So when you think about all of these things together, it really highlights the disparities that exist and how those lead to lower birth outcomes, higher rates of diabetes, hypertension, heart disease. It's all connected. But we got this. There's hope. I try to encourage people that once they get this information, here's what we can do about it. Let's normalize talking about reproductive health. It's health. And let's include this with our younger family members. I talk this up all the time with my nieces that are 16, 14. My niece missed school for a period, and I was like, wait a minute, who are we calling? Where are we going? We're not doing that. That's unacceptable. I talk about this with my son. I talk about this with my husband. I talk about this with the male members of my family, because they need to understand so that they don't then say harmful things. So many times, one of the most heart-wrenching things that I hear is people who are coming to me for support because they feel they can't talk to family and friends anymore because they've heard so many hurtful statements like, well, what are you waiting on? And if it was meant for you to be a parent, you be one. And maybe you're not praying enough and you don't have enough faith, or, you probably can't even afford it. So let's just focus on preventing. All of those things are so hurtful and affect people's emotional and social health as well. Taking the shame and stigma off of it leads to more preventative care. And also sharing and discussing family history. Another big thing that comes up with women that I talk to, and men, is that the minute that they opened up and started talking, they found out that they had grandparents who had had difficult periods, or had hysterectomies that were without their consent, or they found out that they had had all of these other health issues that could have helped them when they were going to the doctor to give insight on their genetics. The other thing I encourage people to do is take control of your health. Go to the doctor, treat your body like you treat every other valuable thing that's entrusted to you. This is a giant piece of machinery. And so the same way that we would take a car in to get tune-ups and checkups, so we would get our tires changed, we have to do that with our body as well. This is the biggest and most expensive and irreplaceable piece of machinery that you will ever be in charge of. Take good care of it. Remember that there's options, and we have to think long-term. So when I'm talking to some of the younger ladies in my life, and they're like, well, I don't have any intentions on getting pregnant right now, and I really don't need all that information, and yada, yada, yada. And I'm like, yeah, but did you know that we're born with all the eggs we're ever going to have? And did you know that advanced maternal age is 35? Did you know that if you are trying to get pregnant and don't achieve pregnancy after a year, you have to see a fertility specialist? Who knew? And that if you're 35 and over, it's 6 months. So these things are important to talk about, even for people who aren't right now wanting to get pregnant, because as we've learned, reproductive health is health. It's more than just having children. It's bigger than babies, is what I try to tell people all the time. And then this one, I say for everybody, the 3P method: a pen, a pad, a plan. Every doctor's appointment, every single time. You want to go in as an active participant in your care. So go in with questions, the same way we would go to a job interview and have questions for the place we're going to. Go in with questions, tell them what you know, give them all the history. There's no stupid questions. There is no unimportant information where it's like, oh, well, I just thought everybody did that. No, everybody might not. Tell them when they're in the room with you, they're on your dime and your time. You could ask them to slow down and repeat themselves. You can even have a friend come in with you, or call somebody on FaceTime and have them be a backup pair of ears or a secondary advocate that can make sure that you're holding yourself accountable and the doctor. And then advocate. So this week, as I mentioned, is National Infertility Awareness Week. So you may see orange and not know what it's about. You may see orange. You may see one of the other symbols are pineapples. Another symbol that we have is rainbow babies. So you may see rainbows that are in muted tones. And a rainbow baby is a baby that was born after loss. So they're considered the golden, the prize at the end of the rainbow, because after sorrow, they existed. So you may see all of those things. Help us by sharing it. Help us by encouraging these conversations. Help us by challenging your own misconceptions about what reproductive health and justice mean. And then I encourage people to put their money where their hearts are. Think about the people who are doing work, who are doing the advocacy, and who are getting out and being the person at the table to get the word out. Figure out how you can support them. Sometimes it's not literally financial. Sometimes it's just sharing their message so that other people who can donate or support can. The Broken Brown Egg, my organization, provides grants for people who are experiencing infertility. Our first grant recipients actually just did their embryo transfer last week, and things are looking good, and we're hopeful that they are going to have a new baby by the end of this year. So helping those organizations that are out here trying to help and support others is also huge. Another organization that I work with, Fertility Within Reach, helps to provide fertility preservation for young people who are experiencing cancer treatments, because cancer treatments can block or hinder someone's ability to have to be pregnant later, or to have healthy sperm and eggs later. And so when you have a 16-year-old who's not thinking about having babies, but unfortunately is dealing with cancer, it's important for us to be able to give them the option to have the life they deserve in the future beyond that diagnosis, so that they don't have another one compounding it. And then here are some amazing resources that support Black women's reproductive health and justice. Most of these are created by women of color, African-American women, but then there's also the larger ones, such as Resolve, which is the National Infertility Association, and the March of Dimes, which many people don't think of as reproductive health and justice, but as I've emphasized, prematurity, miscarriage, stillbirth, all of those things are included as well. And Eggs Over Easy, what I have at the top is an amazing documentary that was recently on the OWN network about the journey through fertility for Black women. And it also gives great insight into fibroids and also the experiences of many couples and families as they experience it. So look some of them up, support them if you can, or even just share their message. It's more of a huge deal than we think. Sometimes we post things. The whole reason that the Broken Brown Egg exists is because I couldn't find anyone that looked like me or anyone who was talking about this. And since I started talking about it just on my own personal Facebook almost 14 years ago, I got so many private messages from people that were like, thank you so much for talking about this, because I didn't know that I had anyone to talk to. One more area that I didn't mention is secondary infertility, which people don't think about as well. And that is defined as someone who has given birth before, but cannot seem to get pregnant again or maintain a pregnancy again. And that is also often a lost conversation that people don't pay attention to, and instead are saying hurtful things without thinking about it, and saying things like, well, when are you going to give them a sibling? Or, so you only wanted the one, aren't they lonely? And not realizing that that person may have been trying and trying and trying. So that is my presentation. I thank you guys so much. And I am open to your questions, comments, or conversations.
Wow, Regina, thank you so much for this. I'm going to stop the recording so that people can feel comfortable asking questions.